Good evening, friends. I'm Dr. J. Mark, and I'm here again today to remind you that today is World Hepatitis Day. And hepatitis is one of the dangerous infectious diseases that we don't get to talk about all the time. Yeah, hepatitis have killed a lot of persons. Hepatitis have equally transformed to cancer, liver cancer in a lot of other persons. So it is important that you know about hepatitis. And the main types of hepatitis that affect people are the hepatitis B and hepatitis C. In fact, hepatitis C, if you contact it, the cure is very far away. And for hepatitis B, it can be managed depending on when it was discovered. So as the world remembers hepatitis today, I need you to know that it's important that you check yourself first to know your status. A lot of people have been having unprotected intercourse, and that is one of the ways to contaminate it if you have anything to do with an infected person. Other ways, some have gotten it through blood transfusion. Yeah, blood transfusion that is not properly screened. You know, a lot of quack hospitals, they just handle bloods anyhow. If you receive from an infected person, obviously you're going to have hepatitis. Also, those who abuse hard drugs and they inject themselves, somebody will use one needle and you also use it. It is also another risk factor for contracting hepatitis. So, the main thing now is there is a vaccine for hepatitis B. I advocate for all health workers, and even it is important that you take the vaccine as a person because it protects you from getting infected. And if you're already infected, don't feel it is the end of it. At least hepatitis B can be managed, but that depends on the time when it was discovered. If you don't show up on time, if it was not discovered on time, it can transform to liver cancer. Now, a lot of men, you see that their stomachs or their abdomen is distended. It's not just fat. A lot of them are having liver disease, which is springing from hepatitis that is untreated. A lot of people come, they don't even know that they already have hepatitis. Then our people also worsen their situation by this consumption of heavy alcohol. You see people doing competition in drinking, and somebody will bragging that he can finish 5 bottles of beer, he can drink 6 bottles, 7 bottles, one crate. Some others have all this heavy alcohol, 42%, 35% in their house. They are sipping it gradually, damaging the liver. It is the liver that detoxifies all this alcohol. So imagine hepatitis is already in your liver and you are now pouring alcohol on it. You are killing it further. So there is need for you to reduce. You're not supposed to take more than 2 bottles of alcohol a day. You're not supposed to take more than that. And you're not supposed to take it all the time. It should be occasional. It's not like everyday thing. It should be occasional. For women, 1 bottle a day. And some people think if they are not taking every day, they can just come one of the weekend and drink like 7 bottles. That is binge drinking, and it's even more dangerous to your health. Don't binge drink. Very important. So, how do you prevent hepatitis? We encourage safe sex. Always use protection or be faithful to your partner because you don't know who is with it. Then, if you have the opportunity to screen yourself, please do screen yourself. Go for normal laboratory tests. They will take your blood sample and they will screen you for hepatitis and other infectious diseases like HIV and other ones. Then, you can also take the vaccine. When you take the vaccine, it can protect you that even when you meet an infected person, the hepatitis will not survive in your system because you have already developed antigens for it. Then anytime you have an opportunity to receive blood, ensure it is properly screened. Do not share sharps. As simple as razor blade. Do not share it with anybody. Make sure you have your own. So with this, I believe I've given you a little education on hepatitis B and C, which are dangerous and which are not always talked about. Thank you and have a wonderful evening as you become more conscious of your health and increase your health-seeking behavior. Thank you.